Hello everyone, welcome to today's video, and I'm very pleased to introduce today with you Dr. Swachitha, who is a graduate of the prestigious JIPMER and who has secured an amazing rank of 112 in this INI-CET and also a very good rank in NEET PG as well, a rank of 751 in this NEET PG which happened in March. So heartiest congratulations, Swachitha. Finally, the exams are over. Finally, you will be joining residency this session. How does it
Yes.
feel? Over to you.
I feel very relieved. Thank you so much. I'm just glad that it's over at this point, and I'm actually very excited for residency to start as well.
Yeah, I'm sure. I mean, residency is a very exciting period, especially for a graduate, because it is kind of something that people look up to. Once you enter into residency, I'm sure that the failure is the same feeling for won't last for a while. But like standing in this side of the building, watching the people go to residency, attending your posting and interacting with the residents, you want to be on that side of the medical
Yeah.
field as well. And I heartily welcome you to the residency. You love it, you'll hate it, but eventually you will like it only. So, Swachita, let's just briefly discuss your journey throughout MBBS. I know you have been a good student throughout MBBS. So let's just discuss in general, how was your MBBS? Since when did you started preparing for the PG entrance exams in particular? And books, reading books versus coaching only. What was your take? Let's start. Let's start from that.
So again, in the first 6 months of MBBS, I didn't do a lot of reading because I was just getting used to the environment and
Okay.
like hanging out with friends and like making friends and like talking to seniors. Next 6 months of first year and all of second year, I studied a lot.
Okay.
Again, the subjects are interesting in second year, and also the books
Exactly.
are nice. Like Robbins
Yeah.
is a great book.
I know, right?
So
I mean, Robbins is, in my opinion, one of the best books that have been written for MBBS students. And a lot of
you really
students
get
find
interested in the curriculum in medicine in general because of Robbins. So I really like that book as well.
exactly. Yeah. So second year, I think most of the students start reading properly, sincerely in second year because both pharma and path are pretty interesting subjects. Yeah. So second year, you did study a lot.
I didn't watch any videos during my second year, but I did have some prep books. So I used that as a supplement to my standard books during my second year. I
Okay.
really refer to standard books second.
Okay. So which books did you read in second year? If
It was Robbins, Goldman, Gilman, and also there was Sparsh Gupta. I used to read a
okay, okay.
lot.
So you
Yeah,
did
and
you read Goldman Gilman for pharma.
a little
Okay.
of that. I used to refer to it, and also our farm professor was really good. So again, his PPT a lot. I used to refer to that.
Oh, pretty rare for a pharmacology faculty of a college to be good because
I
usually,
know.
right?
You were really lucky.
No, so our pharma professor, okay, so among second year subjects, I would say pharma was the weakest department in my college because the path and micro faculty were like amazing, like the best in the hospital, I would say. So even in our college, I think pharma was a little weak. And I've heard in the similar stories about other colleges as well that pharma is usually a little weaker subjects in the colleges. So, chalo, lucky that you have good teacher of pharma. So go
And
ahead.
Apurva Sastry sir is from my college only. So again, we referred to
Okay.
his book, and it
Okay,
was an
great.
excellent book for micro.
Yeah. Definitely. So second year, mostly, if I may summarize, you read the standard textbook, but you read them well.
Yeah, and also I had like prep guides as well, but none of the main videos, none of the coaching apps as such.
Okay. Right.
And then in third year, I did join offline coaching, but I wasn't very sincere with it. So
Okay.
that's like an advice I want to give to juniors. Make sure you want to actually do that in third year, because third year is a very relaxed period where either you can put in a lot of effort or you can decide to relax and like spend time with your friends and all that. So don't waste your money. So like either you go into it knowing that you will do it or don't go for it. It's a good time to start prep though, third year.
Yeah, I think third year is good time because you have ample time to actually attend the coaching. But yeah, you're right. Like a lot of students prefer not to go to coaching in third and fourth year. And like if you've made up your mind, okay, I'll start from a little late. It's fine by me. Then it's fine by you. Yeah, it's totally your choice. But
Yeah, just don't give into sheep herd mentality just because like other people are going, you also go, because it depends upon how sincere you are, how much effort you want to put in your third year. It's a very good time to start, especially with the curriculum change. Now there's only FMT and PSM in third year. So if you're not studying in third year, final year becomes very tough.
Yeah.
But yeah, you have to be like, I think it's important that
Yeah,
you,
it is. And the only thing is that even if you're not able to, let's say, attend the coaching properly, like sincerely, but what I have felt that the notes that I've made during my third year, even though like I was not very sincere, I wasn't like revising them the next day, or I wasn't doing MCQs in third year, but I had a set of notes that I knew I have listened to some professors talking something, and I have my handwritten notes, and they are pretty concise. So it was easier for me to fall back onto
yes.
them whenever I wanted to. So at least this is one advice I would give to somebody who is attending a coaching in third year. At least make your notes at that time, even if you're not like revising them properly.
I agree. If it's even if it isn't active, at least passively, if you could like maintain like a set of notes in your third and fourth year, then like trying to crack it in your internship or maybe in 6 months becomes very easy.
Exactly,
Because
exactly.
otherwise, if you're starting it in your internship, it's not that easy to like make notes, study, and then revise. And it's quite difficult. So if you're
Ye-
starting in your third year, you have that advantage.
Yeah, and I think a lot of friends are also attending coaching, so it is a good inertia. ठीक है, वो जा रहा है, तो let me
Huh.
also come along with him. So I think third year is a good time to start studying if you want to do Indian PG. And likewise for a parallel, I think USMLE, I think some of your batchmates might have also opted for the USMLE route.
It's mainly in third year.
Yeah, it's mainly in third year because you have ample amount of time. So if something academic you want to do, like giving step one, you want to go for a research elective, again, I think third year is a very good time to explore it. Yeah, Swachita, go ahead.
Yeah. And final year, I belong to a batch of 2K16. So that was when the lockdown happened.
Okay.
Final year, if you could concentrate on your final year subjects and be thorough with them, I think that's very useful because later on you don't get that time to like read final year subjects again in that much detail. And once you're confident with your final year, the entire prep becomes easier. Like your first year and second year, all of them come back to you. So that's a very good time to like at least don't even worry about prep, don't worry about any of that. Your final year, just like if you can focus on that, whatever source you use, whether it's standard books or your coaching apps or whatever, if you can finish off your final year subjects and be done with it in final year itself, I think that's very good.
Yeah, I think I have to agree with this point, especially because like they're big, bulky subjects, and
Yeah.
they take up a lot of time if you haven't read them in final year. So like even if you don't want to give like first and second year coaching tests in your coaching, like skip them completely. Final year, keep it for final year subjects and finish
Yes.
them completely from whatever source, as you said. Like during our times, we had review books. The coaching apps were not so popular. So we mainly did from standard textbooks and some short subjects from review books. But again, whichever source I think you are opting, just make sure that you understand the final year subjects and keep those concepts in mind because they're definitely going to help you in internship and PG entrances, right?
That being said, I didn't have a very good lockdown experience, so I didn't study as much during that time because of personal reasons and like
Yeah.
I don't know, like there was a lot of inertia. I didn't take any of my books home because we thought it was a 10-day period and it turned out to be 7 months. So I didn't have any of my standard books with me, and also I didn't feel like watching any videos during that time. So I didn't personally take final year that seriously, but if you could, please do and finish it off.
Okay.
But yeah, so after that in internship, again, I had easy postings in the start, so that was a good time where I was reading leisurely. I wasn't actively like trying to prepare for this exam, but like whenever possible, like maybe in the ward, like solve a few MCQs or like watch a couple of videos here and there or listen to podcasts. It was not very active, the prep,
Hmm.
but I was doing it to some extent. And then the next 6 months, I had very hectic postings. I got dengue, I got COVID. So I was a bit burnt out and I decided I didn't want to I wanted to take a break after internship before
Okay.
starting my prep.
Okay. So like during internship, during the first 6 months, you said, um, did you try to complete some subjects or you were like, okay, let's do internship. Let's keep internship for like doing stuff and like relaxing. I'll study from PG preparation after internship, and that is totally fine. So what?
Yeah, that was my thing. I don't want to completely lose touch with the studying process because getting
Hmm,
started is very hard, like after you've
agree.
given it a major gap. So I was reading, but not sincerely. Like I didn't try finish any subject. I didn't try do any GTs, nothing. So mine was just that I don't want to lose touch with the process of reading, because like if you take a year gap or like you take 6 months gap, it becomes very difficult to start. Once you
Yeah.
get beyond that inertia, it becomes easier later.
Yeah, I have to agree with this point. And this is something I'd also tell my juniors, that at least read some subjects. Like even if you are not able to complete everything, it'll be easier for you to crack in the next 6 months if you study something in the internship.
Yeah.
I'm not saying that you'll crack it in
Yeah.
internship, but makes the whole journey a little shorter. Hello? Yeah.
Yes.
Yes. So, how was your preparation? What was your strategy, exam strategy after you had completed the internship?
Okay, so after the internship, I wanted to take a break. I know that's not normalized yet in our
Okay.
society, but I personally thought it was fine. And my parents don't belong to a medical background, so convincing them was a bit difficult. But I wanted to. I think you have to be mentally very prepared to like set for this journey. Like it requires a lot of effort. There are like probably 10% of people who are really smart and like effortlessly they can crack it. But most of us really do need to put in an effort. And I think you have to be mentally ready for that. You can't, like, it shouldn't be a half-ass attempt. Like, it should be like you should really work for it. And I wasn't ready immediately after internship, but once you get ready, I think you have to put in proper effort and dedication and sincerity and like be like regular with your studying and all that. And that helps a lot. Like once you're
Oh,
continuous.
yes, I think those 6 months is, I think, enough time to crack a PG entrance, but those 6 months need to be like a condensed,
Dedicated.
focused study, dedicated
Yes.
study,
Yeah.
right? So when you finally thought that, okay, I'll start my preparation from now, you had like a mental map. Ki, okay, there are 19 subjects to cover. I have covered these subjects well in my MBBS. These are my strong subjects. These are my weak subjects. I've watched some videos. I have talked to my seniors, my teachers. I have gained some knowledge how to prepare. So, what was your roadmap about the whole preparation journey when you started?
When I started, so I didn't have any set of notes to begin with. So I think if you're in third year and final year, making that set of notes is very important. But if you haven't, as an intern or a post intern, I think the best thing you can do is go for revision videos. So that's what I did.
Okay.
Because that helps you finish a lot of subjects very quickly and you get confident. So
Right.
that is one thing I did. And again, GTs, I was a bit anxious to give GTs because again, it can be a bit nerve-wracking when you don't get the scores that you want and all that. But I really think that I didn't use it as much, but I really think doing one GT per month at least in your first 2 to 3 months of prep, and then continuing with two to three GTs per month is really helpful to like if you're simulating the environment of the exam early on, then the exam itself doesn't become that difficult. It feels like any other regular test that you give at home. So I think that GTs are very important.
Yes. Agreed. GTs are very important. Even I gave GTs during my preparation, but I think I gave only three GTs as far as I remember. Because the thing with me personally was that uh, I hadn't completed my primary reading of the
Yeah.
major subjects itself. So I thought that the GTs won't actually reflect my preparation because I'm not yet prepared. And the second thing was that taking GTs, reviewing it takes up some time. And
Yes.
I thought that let me put in that time to actually read what I want to read because I knew what I wanted to read. I had done previous year questions. I knew the list of topics and I had made some notes. Ki, okay, this is, I'll read ENT from here. I'll read Ophtha from here. I knew it. So that was my personal approach to it. And as you said, your focus during those 6 months was like RR, revision videos, and then notes. Which notes?
What I did is basically I went on a couple of study grams and some of them have lists of the frequently asked topics.
Mm-hmm.
So I went through the frequently asked topics list. Then I watched the revision videos, and after the revision videos, I practiced the PYQs. Not reviewing the PYQs, but practicing them for the first time so that I know if I don't know an MCQ, how do I solve it? Like that requires practice. So
Mm-hmm.
again, so that's what I did. First, know the frequently asked topics, then watch the revision videos, and then do the PYQs, and then skim through the revision notes again. So
Okay,
that was
so
my main prep.
Okay, so the total source was the revision videos and the revision notes.
Yes.
If I would summarize, like not the main videos, not the main notes as well, just the revision videos and revision notes. And I think that worked really well for you. That has
With
worked
PYQs.
with PYQs. I think this concise material, if you take this concise material in the starting itself, you don't need to work a lot to make the material concise. It is already available to you, I think. And I think I've heard the similar strategy with my junior also, Aman Tilak, and Aditya have done a good interview with him. I think a lot of you should watch that interview, in which he said that the revision videos plus revision notes and PYQs actually suffices the everything must know things. And like if you know the must know topics in each subject, I think you'll definitely get a top 500 rank for sure. Uh, Apart from adding it somewhere or the other from PYQs.
So again, so NEET tests breadth and INICET tests depth of some topics. So like once you do the revision videos, at least you're covering the breadth of everything. So that's a good preparation strategy for NEET. And once you're done with NEET, in the remaining time, like going through the PYQs of INICET and then going into a depth of like those particular topics really helps. Like it becomes simpler, the process. You want to make it as simple as possible because 19 subjects is really hard to do like once at one go in 6 months.
Yeah, definitely. So for going into depth of each important topic for INI, what was your source?
For those, I would go to the main video's notes. Like I would not watch the video, I just like go through the notes. And if at all I found it very difficult or confusing, then I would refer to the video.
Okay. I think this actually is a very good strategy because if you have a strategic approach to the things that you want to read, you'll avoid reading the unnecessary things automatically. So this is one important point that I want to highlight, that revision videos plus revision notes plus PYQ actually summarizes your whole PG preparation. And this is one thing that used to happen in our times as well. So we didn't have revision videos and revision notes as nowadays, but we did have like 3-4 days classes of short subjects where like short subjects were covered entirely by a faculty in 3-4 days, and they used to give you a set of notes. So I think on a similar lines nowadays, revision videos plus revision notes cover all the important topics as well now. So you don't really need to watch the main videos and notes if you have a basic understanding of the subject, right?
Yeah. This is when you have a basic understanding. Like you have to, like if you don't know, have any clarity of the subject, it's better to watch a couple of the main videos as well. But if you've read properly in your MBBS, then revision videos are more than enough.
Agreed, agreed. And so let's talk about the revision plan. So how many revisions did you do, and in how much time?
So my first reading, I think, took me 3 months.
Starting from when?
So I started mainly after the November NECET. So mainly December, January, and February. It took me three months, and then the exam was in March. December, January, February. Yeah. So the exam was in March. I had only some 10 days or something properly for NEET revision, so I didn't have that much time.
Okay, okay.
Yeah, but then for INICET, I had a lot of time. So like by that time, I was done with the entire revision properly. And then for NEET, again, after NEET, I had 2 revisions for INICET.
Oh, that's great. I think so total 3 revisions for till INI. I think you got to know which are the important topics by revising again and again. And I think you focus for INI only those important topics.
Yes, I think, and also I do agree that this revision strategy is important, but not for every topic of every subject. Some topics require multiple revisions. So for example, like in psych, disorders of thought, and also the durations of different psych diseases, illnesses, and all that.
6 months
And
versus 1 month.
also in medicine, also like for me, arrhythmias were a little difficult. So certain topics like that require multiple revisions. So this didn't fall in the strategy of 3 months, 2 months, 1 month, and all that. So this I was doing again and again. So I was trying to make my 20th notebook early on. So I watched a couple of videos of the important topics. And based on that, if I thought it was difficult, I'd watch them again and again or read them again and again.
Okay. So the 20th notebook that you're talking about, so like in my opinion, how you would have made it, let me say. So like when you were doing your first revision, you were doing your first reading, simultaneously you used to write in your 20th notebook, okay, this topic is weak, this topic is forgettable, I need to do multiple revision. And uska ek chota sa summary you used to put in the 20th notebook, right?
Yeah,
Okay.
that's exactly what I did. And also I've used first aid because it everyone has talked about it, and because of that I really wanted to give it a shot, and it made my prep very easy towards the end. Like I was able to revise like systematically each subject, each topic, each in medicine. I was able to do systematically everything very simply. Like it took me maybe like 3-4 days to revise
Right.
it in the end.
So let's talk about first aid. I'm really happy that it helped you. It helped me. It helped Aditya, and that's why, like, we personally promoted. We don't have any brand sponsorship from first aid per se. But let's talk about first aid. Which subjects did you read from first aid, and when did you start reading first aid?
So I had my first aid book from third year itself.
Okay,
So yeah, but I didn't really read much of it except for micro and biochem. Those two
okay.
subjects are really well in first aid, and I think you can really decrease the amount of time you spend on these subjects by doing first aid.
Definitely, definitely. I think biochem is what, 50 pages, and micros again, I think 40 pages something. And
Yeah,
like everything in tabulated form, everything in flow diagrams, everything cycles and
yeah.
images in micro. So I think for these two subjects, so definitely first it is a very good tool. So,
And also, when it comes to pharmacology, I don't think doing the entire subject in one go is that advisable because it's very forgettable. So when you
mm,
use first aid, all the drugs of that system are summarized in one page. So you can divide pharmacology into systems and do that like separately. So today I'm doing only CVS and
mm.
do it from whatever videos or whatever notes you're reading, and also just refer to that one page in first aid. It becomes so easy. It's only one page.
Yeah, I mean, your whole reading and everything gets summarized while you are reading first aid. Now, it's so beautifully described. I think that book, whoever has made that book, and by the way, it's an Indian who has written first aid, if you know it.
Oh, I had no idea about that.
Yeah,
Wow.
so it is written by an Indian mind. So he knows how to like concise everything, and it's written in a really easy way for you to revise the stuff. So it is mainly a revision book, as you said. You had bought it in third and fourth year, and a lot of students still ask me, sir, should I read first aid from the start? And to them, I tell you, कि it is a revision book. So when
Hmm.
did you actually start using first aid? So first you said that you used biochem, micro for first aid. Any other subject? Pharma you said.
Yeah. And also the systems. I didn't initially use first aid for all the systems and all medicine and all that, but like when I was doing my second division, I just flipped through the pages. It's not even reading that much, it's
Mm,
just flipping through the pages and you get a general gist of the entire subject very quickly. So I refer to all the systems also from first aid
okay, that's
in
great.
my
So
second
main
division.
after NEET.
Yeah, after NEET.
Okay, and like it really consolidated your whole first and second year at least, I
I
hope.
had done my first reading, so at this point it was just going through it. And once I just went through first aid, like it got over in like 2 hours. Like it doesn't take that much time to read the subject from first aid because you don't want to go in depth. It's not for like memorizing each and every point. It's for getting
Mm,
those memory aids. Like after
mm,
your first reading is basically you trying to um, understand all the concepts and all that. And once you understand the concepts, your memorization becomes very effective. So this
right.
first aid comes in for the memorization part, which is very effective, like the memory tools that they have, or the mnemonics that they have, or the flowcharts they have, is very effective, especially once you've done your first reading or understood all the concepts.
I think, yeah, this is something like Zainab also talks about, that making connections and making roadmaps. So whenever you get a question in the exam, it's not sometimes related to one particular subject. It's related to multiple topics, multiple subjects, and a lot of inferences required. And I think first it helps you build those roadmaps, those mind bridges, those links between different subjects, because that is how it is structured. Once it talks about cardiovascular system, so it will go from embryology to anatomy to physiology to pharmacology to pathology, right?
Yeah.
Okay, so you read it
Using
during your...
it as the main resource.
Yeah, yeah, go ahead, go ahead.
No, I was saying that using first aid in your first revision as your primary resource is a bit difficult because it's difficult to understand everything. But once you've done your first reading, or while doing your first reading, if you could just refer to those pages, it becomes very useful.
Okay. So for minors and majors, a lot of students, especially majors, they ask me, sir, medicine, surgery, PSM, these three things, kahan se padhni hai, where to study?
So for medicine, if you've done it well in your final year, I really don't think it's necessary to read medicine, especially for INICET, which focuses most on your first and second year. In for NEET, again, there are certain topics that you can read in depth for medicine, but again, the entire subject as such is not really necessary. But that's with the consideration that you have some basal knowledge of pharmacology and pathology, or maybe medicine from your final year.
Right. For other subjects. So where did you read medicine from?
So I just refer to the revision videos for medicine.
Okay.
That's it. I didn't do
Revision
more.
notes and revision videos.
Yeah, but not like I didn't even revise that medicine. I didn't revise later on.
Okay, great. Michelle, same was my strategy, that I had read medicine and I thought that medicine revision takes a lot of time and especially it's not so important. And yeah, so surgery, PSM.
So surgery seems complicated, but when you break it down, it's not that much. Like the classifications in surgery are very important. Emergencies in surgery are important. Trauma in surgery is important. So
Breast is important, yes.
breast is important and thyroid is important. There are topics that are important, but if you break down, if you talk about surgery as a whole, it's big. But if you break it down to chunks, it becomes easier. So when it comes to like major subjects like this, when I couldn't afford to give too many days to that, I'd break it down to that important topic as such and spend like maybe an hour or something on that on one particular day instead of like doing the entire subject in one go, because if that consumes too much time, I wouldn't have time to do other things.
Yeah, I think especially surgery is I don't really consider it as a major subject anymore because they're so focused in asking the questions.
It's
Like
very focused.
yeah, because they won't ask you about various pancreatic surgeries or very complicated GI surgeries that are usually taught in coachings. And likewise, they won't talk much about urology as well. They are very focused about things that they want to ask in INI and NEET both. So I think surgery needs to be a very focused subject while reading. So let's talk about PSM.
So PSM, there is this one professor who puts a lot of content on Instagram and makes good flashcards, and I really refer to only him. It was really, really concise at the end. It was like only like 50 pages or something of notes, and he covered all the previous year questions, all the important topics, all of them made to be very simple
Which
and
one?
relaxed. Rajesh Shetty, sir. So,
Rajesh Shetty, sir.
yeah.
Okay, that's really great. I didn't know about this. So what I did for
I
biochem.
think a lot of people refer to him. He's quite popular on Instagram these days. So
Okay,
his
that's
content is really good. Even if you're using another main resource, if you could just go through his flashcards, because it's very nice. It's like if you're looking at pictures, it's easier to remember than if you're looking at text.
Right,
So
definitely.
I think he made it really easy for me. And again, INICET tests a lot of biostats. So, and I referred to Zainab videos for biostats, and that was it. Like that was done.
Okay, great. So let's just talk about one important subject, anatomy, which a lot of students fear, and a lot of students, and it's something that is asked a lot in exams also. I think around 15 questions come from anatomy. So how did you approach anatomy?
Anatomy, since everyone is so terrified of anatomy, and so was I started early on. So when I was in the peak of productivity, I was like, I will finish it off, like my first reading of NAT, so that I'm less terrified of it later. And that I think is very important. If you think you're weak in a subject, tackle it first. Because like you, otherwise, if you're procrastinating it, you will end up not doing it. So I think it's important to tackle it first. But again, it's very volatile. So it requires some topics require multiple readings. Like again, brachial plexus. I think I posted a thread on Twitter also about this. I've read it multiple times to like get that level of confidence in it. And when it comes to volatile topics, volatile subjects like anat, keep it your last revision towards the end, as close to the exam as possible. So that is another thing I did. Because like Subjects like surgery, for me, it became quite easy. So I didn't have to revise it a day or two before the exams. And that again was difficult even towards the end. So I kept it on the last day. That was my strategy for the NAT.
And where did you read ANAT in the beginning, the first reading?
The first reading, again, revision notes,
Okay,
I
same
didn't have
concept.
anything else.
Great. ठीक है. So let's talk about the last 10-day strategy. And you said that you used the strategy that how to revise everything in the last 10 days. So how did you do that? How did you plan that last 10-day wala journey? Which subjects to do first, which subjects to keep in the end, how much to study?
Okay. So I think when it comes to your second reading, especially, maybe in your first reading, you might not have much of an idea, but in your second reading, it should be focusing on the last 10 days and probably 15 days. Like if 10 days seems a little risky for you, 15 days in mind. So in your second reading, you should make your 20th notebook or make post-its or bookmark different notes in like whatever app you're using. I think second reading helps you do that. Like make it everything as concise as possible. Make sure that you can revise like maybe the short subjects in a couple of hours and the big subjects maybe in like a day, max a day.
Right.
So,
So which subject did you do first? Which subjects did you keep for the last?
I watched Zainab Boran ma'am's, she had a lot of videos previously. So those videos I watched in 2 days, the entire thing. So in that way, I was able to get a view of the entire subject. Like I'd already watched them before, so just reviewing those notes is very easy. So that I did in 2 days. And then I started off major subjects. I started off with the major subjects. So I finished off medicine, again, not that much time. In half a day, I was like, okay, enough of medicine. Surgery took me one day. OG, I think, is a lot about numbers. So once you got those numbers down, I think OG becomes easy. So if you could concise all of OG into like a couple of sheets, like at this week this happens, at this week this happens, terminate the pregnancy at this week. If you like concise all of that, again, that can be revised in like one day. So I did, and then pathology, I didn't really revise except for general pathology towards the end because once you've done your first reading and second reading, pathology is not a lot of rote learning. So once you've done it, it's done. Like you don't need to revise it again and again, except for like maybe stains. That is something general path can be revised again. So that's what I did. And pharmacology, again, in the last 15 days, pharmacology, again, I broke it down. I'm going to do this system today, this system today. That was my strategy for pharmacology. I kept an NAT towards the end, and the thing is I got sick 5 days before the exam, so that was very stressful for me. I got a fever. I had to get admitted, so I really thought I had to take another 6 months. Like I didn't know I'd be able to crack it this time.
Yeah, I think if you get sick in those last 10 to 15 days, it's like really tense because all your 5 months of preparation boils down to like revising things in the end.
Yeah,
And
my parents said you put in a lot of effort in the last 6 months. These 5 days won't matter as much, but I also know how important those 5 days
yeah,
are. For
I can totally understand. Yeah.
yeah, so I was really stressed because 5 days before the exam I got sick, and 2 days before the exam I was in the hospital. And
Oh,
yeah, so one day before the exam I was discharged, and at that point my main strategy was to remain calm because I think in this exam, yes, your last 15 days matter a lot. It's very, very important if you are able to revise the entire thing. It's really a game changer. But also being calm is more important because like you don't want to lose out on silly mistakes. You don't want to like lose your bankable questions by getting stressed. So my
yeah.
main strategy on the last day was to remain calm, and opening books was not good for me during that last day because I'm like, if I can't, there was so much to revise, I wasn't able to do any of it. So
Yeah.
yeah, so in the last day, I was just sitting and like trying to remain calm, watching like Ashirwad class of Zainab Borham ma'am, and like just staying away from books as much as possible. And I had mentally thought that I'm just going to go calmly, give the exam, and if it works, it works. If it doesn't work, 6 months, it's fine. Like this is not in my hands. If I get sick, it's not my fault. So that was
Yeah.
my strategy, like on the last day of the
Yeah,
exam.
I think getting INI-CET, I've always felt that it is about how confident you are in the exam. And
Yeah.
like if you are sure कि ठीक है मतलब जो होगा देखा जाएगा, and let me give the exam. It is a good exam to give. Very good questions they ask in any set. And I think a lot of questions you can answer just by ruling out stuff. So if you
Yeah,
have
you
been a
can logically reason
Hmm.
yourself through a lot of the questions in INICET. I agree.
Yeah, and not likewise in NEET, I would say, but I think INICET definitely ask some questions, especially for those students who have read well in their MBBS. For them, especially, I think NECT is definitely a good exam and a very crackable exam also, because a lot of students fear that, okay, it's a very prestigious, very hi-fi exam. I'm not up to that standard to clear it. But in my opinion, the NECT is a very predictable exam and is an easier exam to crack rather than a NEET PG. Because you can rule out of a lot of stuff.
Yeah. So keeping all that in mind, I was like, okay, you remain calm. It'll be fine. Like you have your concepts clear. You'll be able to answer based on like MCQ solving strategies. Like if you've gotten that right, so just apply those principles, read the last line, try rule out the options, try to logically reason yourself if there are only two options which you're getting confused between. So I was like, I will concentrate on that. And because I couldn't concentrate on the theory in the last day.
Hmm.
The only things I did on the last day were revise IPCs and revise milestones because I didn't want to lose out on those.
Right, right. I think this everybody should revise because milestones. So I think usse pehle to there is no use of remembering milestones because that is something you will forget. I think even students who prepare for MD pediatrics practical, they have to revise milestones just a day before their practical. So nobody can remember milestones and definitely IPCs. So regarding the exam, just few questions. How many questions did you attempt?
I attempted 190. I
Okay.
thought this paper had a lot of atypical questions and bounces as well. My strategy was to be a bit more aggressive than that. I wanted to attempt 197, but
Hmm.
considering that there were a lot of atypical questions, I thought the rank deciding would also be based on the negative marking. So
Hmm.
I was like, I'll cut it off at 190. But I think even 185 would have been fine. There were a lot of toppers who did 185 as well. So be
Yeah.
aggressive, but also take into consideration that the toughness of the paper.
Yes, I think 190 in this exam was a good attempt. And during the exam, did you feel that there is a time crunch? How did you manage if there was?
Usually, when it happens, either you go too slow in exams or you go too fast. I belong to the latter. I used to complete my exams very quickly. So by doing that, there were a lot of silly mistakes. So my approach was to go a bit slow compared to normal. But again, when it comes to NEET, it's very easy. Like you have enough time to revise. For INICET, you don't have enough time to revise the entire paper for sure. So you have
Hmm.
to be very careful with what you mark for review and if you want to mark for a review, because
Hmm.
for INICET, mark for review is not
Yeah,
counted. So
not
what I
calculated.
did is I in the rough sheet itself, I used to mark these are the
Question number
questions that
23,
I
question
want to
number
refer to
85.
again. Yeah, so I was
Hmm.
able to finish the paper 30 minutes before the due time. And in those 30 minutes, I was able to go through, I think I had 24 questions marked for review.
I think great. Think I also do the same thing when I attempt a paper. So if it is a 3 hour paper, so that makes it 180 questions. So I subtract 30 minutes. So I have target key in 150 minutes. I have to complete 200 questions. And like I break it down into further sections. So let's say 30 minutes, I have to complete 40 questions. So
Yes,
that is
exactly. That was the exact strategy I used for
yeah. So it
my
keeps
exam.
you headed. Ki, okay, 30 minutes have lapsed. How? Where am I? Where am I standing? I need to quicken up or whatever. So I think Swachita, that was a really nice
And
strategy.
also,
Yeah. Yeah. Go ahead. Go ahead.
regarding this only, be very careful with what you mark for review. So I personally believe that if it's very theoretical, your first instinct is right. So don't question
Hmm.
it again by going back to those. Don't mark those for review. And if you're trying to guess something which is you have no idea about, again, you can't expect miracles to happen for you to magically get the answer again. So
When you
again, if
review
you're
it,
going to
yeah.
answer that, answer it and leave it. Go back to
Hmm.
those questions which require some higher order thinking, where you think, I know this, but I can't exactly remember this right now. So those are the questions that you mark for review and go back to.
Yeah, it does not mean that tough questions need to be reviewed. It's just that those you have confusion in just needs to be reviewed. Right. So I think that sums up everything that I wanted to say, in fact, in my video as well. So if you are someone who is starting now and like if aiming the November INI, a good strategy is to target the revision videos and notes right now, along with PYQs. Do your first reading in 3 months, let's say by August end. So there are 3 months till August end. From September to mid-October, the second revision, and during the second reading, try to summarize the thing for the last 15 days. And then from let's say mid-October to 1st November, try to finish everything in the last 15 days. And I'm sure you'll get a very good rank.
Last 15 days, you just have to read as much as possible, like without thinking, without doing, but just like try finish all the 19 subjects, because that really helps you like with your confidence during the exam.
Yeah, I think and I personally would suggest that if you're starting now and like haven't read for like 2-3 years properly, so in the last 15 days, I think giving GTs does not really help, because I think in that time covering the whole syllabus, keeping it fresh in your mind is more important.
I don't think GTs in the last 1 month
Yeah.
also is necessary, especially if you're getting anxious. Like
Yeah.
up till that point, it's a good simulator
Yeah.
of the exam and like helps
Agreed.
you like decide time and all that during the exam. But in the last month, it's really not necessary if you're getting anxious. And especially during the last 15 days, it's definitely not needed.
Yeah, agreed. So I think it's really nice talking to you, Swachitha, about such thing, because we both are on the same page regarding this. And a lot of toppers and a lot of my juniors as well who have done well in INI-CET this year have said the same thing, that it's more important to revise the important topics again rather than covering the breadth of MBBS again during your preparation, because FOMO kicks in really easily, especially when you're preparing for PG, because there's a lot of content to be covered. And in my opinion, what my seniors used to tell me, that Rishabh, chill, covering everything, covering the syllabus is tougher than clearing the exam. So I think that imbibed me really well. I don't need to study everything. And another
be confident in like a few topics, and that will help you a lot.
And another thing that I felt, that a lot of students think that when I'm preparing for PG, I should be like a good doctor and read everything because like I'm completing my MBBS. To them, I would say it is more important to clear this exam, because this exam maybe is not testing whether you are a good doctor or not. It's just the exam to be cleared. So like take it as an exam to be cleared. That's it.
It's the next step. Like you cannot further go on your career if you don't clear this one step. And it's not worth so much of your effort and time. So just clear it as fast as possible.
Yes, definitely. So, Swachita, which branch are you interested in?
Sir, I'm planning on taking radiology in Jupmer, most likely.
Okay, chalo, great. Welcome to the world of imaging. And you love radiology. I think radiology involves a lot of reading, especially for newcomers. It's a new subject because not a lot of exposure happens during MBBS. And I'm sure you'll do really well in radiology. Let me know if I can be of any help.
I look up to you, sir, and a lot of other radiologists. I'm really excited to enter in this.
Yeah, definitely. It's a really nice branch. And usually when I was in my MBBS, I never thought of taking radiology. I was like, I'll take surgery. I like scrubbing in the OT. I like doing things in minor OT. So it was surgery. But now, like 5 years after doing radiology, I cannot think myself of being a surgeon. So it is something that grows on you. Radiology is something that grows on you. You get into the clinical system without actually being in the clinics. So that really is a very nice thing about radiology. Chalo, Swachita, let's wrap it up. Really nice talking to you. Really love discussing your exam strategy. And good luck for the residency counseling.
Thank you so much, sir, for this opportunity.
Bye-bye.
Bye.